I came to the emergency room one night. I woke up and I couldn't breathe. And they helped me, and Vanessa came in afterwards and said that she could help me get a doctor and some care. And she did, and I've been seeing the doctor regularly now.
Mostly the clients that we're serving are uninsured, or they have Medicaid and they just do not utilize the ability to have a primary care physician.
So adults that don't have health insurance basically can't go to the doctor. And so if 50% of adult Americans have a chronic disease, then you know that for those who lack health insurance, it's a terrible travesty. They are twice as likely to end up in an emergency department seeking care, and 3 times as likely to miss doses of their medication either because of lack of access or cost. So the life coaches refer patients to us. Although the life coaches work with both insured and uninsured clients, they do see a lot of uninsured patients.
My name is Vanessa Dunlap. I work as a life coach at Secours Maryview Emergency Department in Portsmouth, Virginia. The Life Coach program is a program where we connect patients who have chronic conditions and no primary care doctor.
My name is Amy Price, and I'm the medical director of the Secours Hampton Roads Caravan and the Maryview Foundation Healthcare Center. The core of the mission of Secours is to provide health access to the uninsured. We care for the sick and the poor and the dying. And with that as our mission, the Life Coach program is a novel approach to providing patients with access to health care.
We have found that the Life Coach program has succeeded in keeping more than 60% of our clients out of the emergency room and receiving their care through their primary care physician.
For every dollar that the hospital spends on our health programs here at the Maryview Foundation Healthcare Center, we were saving about $5. And that wasn't so much a reduction in the emergency department utilization, it was a reduction on inpatient admissions. These patients all have a chronic disease. We're keeping them from being admitted. We're able to provide them with top-notch medications, and the average patient that comes here to the clinic gets between $300 and $600 a month worth of good quality medications direct from the manufacturer through our pharmacy assistance programs.
I love being a life coach because the feeling I get when I come into an emergency room and I see a patient who has been struggling with high blood pressure that can't take their medications because 1, they can't afford it, 2, they don't have a doctor who will continue to write them prescriptions, and they're scared to death. And I get to tell them that there is hope, there is help. I have had several clients ask to give me a hug afterwards and are crying because the news that they have heard is what they have been looking for and didn't know existed.
Well, I would definitely recommend the program because, I mean, it's a lifesaver. It saved my life.
We've got the solution.